Every 2 minutes, a woman is diagnosed with breast cancer. Affecting 1 out of every 8 American women, it is the leading cause of death between the ages of 40 and 55. There are many risk factors that play a role in developing the disease, but one of the strongest is one most women aren't even aware of. Women with high levels of breast density are 4 to 6 times more likely to develop breast cancer than women without dense breasts. Yet a recent poll demonstrated that 95% of women don't know their breast density.
Well, actually, breast density is an independent biomarker for breast cancer risk, and it can actually increase a woman's risk to develop breast cancer by 4 to 5 times over that in a patient who has fatty breast tissue. In the past several years, this has become well known as certain patients have suffered from the poor performance of mammography because they had breast density.
For women aged 40 and older, mammography has traditionally been the most important tool for the early detection of breast cancer. But for women who have dense breast tissue, the procedure has known limitations in detecting cancers.
So mammography really has great limitations, particularly in patients with dense breast tissue. Actually, mammography is a 2-dimensional examination, and we're trying to image a 3-dimensional breast. So we have issues with tissue overlap. Also, breast cancers are going to be white on mammogram, and normal glandular tissue is white, so if you superimpose a white on white, it's going to be very difficult to identify. It's sort of like trying to find a snowball in a snowstorm.
Recently, however, several scientific studies have demonstrated that supplementing mammography with ultrasound for women with dense breasts finds a statistically significant number of additional cancers.
What we have found through all these studies that have been performed over the last 10 years is that when we add screening ultrasound to screening mammography, we're able to double the number of cancers that we're finding on patients who are asymptomatic. And the types of cancers we find are of those that have good prognostic factors. They're small, typically less than 1 centimeter in size, and typically have not spread to the axillary lymph nodes. So they're early, very important cancers to find.
New technologies, however, are changing how women with dense breast tissue are screened for cancer. Used in conjunction with mammography, automated breast ultrasound is a groundbreaking imaging technique that provides clearer and more precise images. Unlike mammography, which uses radiation, automated breast ultrasound uses sound waves to create 3D images of breast tissue and has been shown to successfully find cancers not detected by mammography.
There are a lot of advantages automated breast ultrasound has over standard handheld sonographic imaging. It's a rapid examination that usually is completed in less than 10 minutes, scanning both breasts. It's also a reproducible exam and independent of the operator. And it's very reliable. It's reproducible and reliable, which is something that's very important. It also gives the physician the opportunity to take on the responsibility of identifying the breast cancer themselves, rather than relying on the technologist to identify.
The process is very different than a mammogram. A woman lies down on a table and the scanner is placed on her breast and with gentle compression. So unlike a mammogram, where 2 glass plates squash the breast in a vertical direction, this is a much more comfortable process. Women comment that it's much more comfortable than a mammogram, and we feel that this will make it an even more attractive test for women.
The SomoV automated breast ultrasound system developed by U-Systems Incorporated is being used here at the Center for Breast Care at Boca Raton Regional Hospital. Utilizing proprietary hardware and software technology, this unique product provides an industry-leading 3D volume view of breast tissue, delivering superior image quality for greater cancer detection confidence.
The SomoV is the result of about 10 years of research and development, also about 2.5 years of clinical trials that have gone to improve and refine the product. So it's the only product that is designed specifically for ultrasound screening of dense breast tissue. It is the only product that will have an FDA clearance for screening women with dense breast tissue.
Taking less than 15 minutes, Automated breast ultrasound is a comfortable procedure that patients say is completely unlike a mammogram experience.
Mammography is a test that is much more painful than an automated ultrasound. The automated ultrasound, it becomes very relaxing test, smooth, and less uncomfortable than a regular mammography.
Not only is the ABUS more comfortable, but in this case, detected cancers missed by mammography.
I'm very thankful to the automated ultrasound because thanks to that they were able to find my cancer. I have 3 tumors in my both breasts. In the regular mammography, it won't come out. And thanks to the automated ultrasound, it showed up that I have the 3 tumors. Very small, but thanks to that, I'm alive.
As the worldwide leader in automated breast ultrasound technology, U-Systems has made it their mission to assist radiologists and physicians in the early detection of breast cancer in women with dense breast tissue in the most cost-effective way possible.
It's very important that women understand if they have dense breast tissue or not. Dense breast tissue is really a problem in 2 ways for women. The first way is that the gold standard, which is mammography, does a poor job of seeing lesions in dense breast tissue. And the second issue is that women with dense breast tissue are at a 4 to 6 times greater chance of having cancer.
Countless women with dense breast tissue have suffered late-stage cancer diagnosis because their annual mammogram failed to detect cancer year after year. The increased use of automated breast ultrasound is just a small part of an overall national effort led by survivors to require that all women be notified of their breast density and be informed of alternate screening methods.
There is a grassroots effort that's involved with several states now, Connecticut, Illinois, Texas. There are about 4 or 5 states with pending legislation that will mandate that physicians tell a woman if she does have dense breast tissue. We think this is very important because armed with the knowledge that you have dense breast tissue, you can then ask for additional tests, such as this MOV.
U-Systems Incorporated, the leader in automated breast ultrasound. To find out more, please visit usystems.com.